I think I'm gonna be able to post the recording, or definitely post the job alerts from what I saved. There was about 5 or 6 that I pulled. So I'll be saving those back onto job alerts, but if you grab them, great. You have them already available. I'm open to questions on what to look for if folks are looking for something and can't find it. So feel free to put that in the chat now. But otherwise I can stay on what I was trying to do earlier, which is look for more remote options, more for-profit, private sector, membership-based kind of jobs. Yeah, we can get the recording. Yes. I'll get that recording. Okay, so I'll just stay on what I was doing. I was trying to tell the group earlier that there's these like, ooh, perfect example. The Infectious Diseases Society of America. Love it. So this is probably salesy. The business partnership is telling me that they're probably looking for someone who, let's see. Business, adult, 3 years in convention planning with a concentration in exhibitions and corporate support. So, Cynthia, are you on? Yes.
Yes.
Great example of like, how do I, like, does this even, right? These are the,
really had them like 3 years, but like collectively.
yeah. And it's okay. This is the stuff where you have to ask yourself these tough questions on like, do I even have experience in putting together conferences, right? This is saying conferences at the end of the day. And maybe you don't, and then you move on, and that's fine. But you have to be able to take a minute, take a beat, right? And ask yourself, do I have this space? But maybe you have, maybe take a minute and recognize they're talking about best practices, scientific convention management, adult learning models. I have talked to some folks who are coming from like publication spaces, literature review spaces. They were maybe publishing, right? So some of you are stuck in the space of like, how do I move over from like helping with best practices and pushing out certain knowledge, right? Or, and stay in these sort of public health administration roles. So I'm just sort of pointing out, it depends on where you're coming from. And if this makes sense for your background, but it does take, right, the sense making piece. And where's my chat? Shoot. Oh no. Where's my chat? I'm gonna stop sharing because I need to find this chat. There we go. Why can't I find you guys? That is so weird. I know I moved you, but did I move you like, hold on. Oh, there you are. You're like buried in the corner. No, that's not you. The heck did I do, guys? There you are. Jesus. That was weird. I couldn't find the chat. Like it disappeared for a minute. Okay. Just gonna leave you on the side just so that I can find you. HIV, Peace Corps. This is what I got a question about. Over 100 people. Well, this says clicked apply. It doesn't say 100 people applied. But regardless of what that number says, I say ignore it. The number that matters is when they posted or reposted. Yes, you can still apply to repost it. I've been getting that question a lot. In fact, like if they posted it and then like a month later you see they posted it again, that also works. I have been hearing some folks get callbacks the second time, so it's yeah, so this is a good entry level, kind of a mix of options, even nursing. You have that under your belt. I'll save this. Put it in the chat. But I'm not liking this terminology. I'm gonna change it up. I'm gonna try collaborative, maybe open it up to a week. I do a week or 24 hours, guys. Get comfortable with that. Super important. It helps with the burnout, seeing the same jobs over and over. It just gets really exhausting if you see the same stuff. I know you know what I mean. Some of these I've been seeing, I already saved, so I'm kind of passing them up, but if you want me to go back, let me know. This one is fellow support associate. I think this is you overseeing the fellows, not a fellowship. So 2 years with recruitment, supervision, mentoring, fellows. So this is if you've been in a somewhat supervision space, you've maybe managed volunteers. I think it's a great pivot to Public Health Institute. More people are getting in with the hired method. I do know one person who got in just this last year, and then people getting through multiple rounds. My mentee hopefully will get an offer from them soon. They just dragged their feet. She finished 3 rounds with them. 3 rounds, guys. 3. Oh my God. Oh, it's like, can't believe they put us through that stuff. Health program advisor, who are you? Paying 120,000 to 350. Please don't tell me you want a doctor. This chat is really annoying me. No, we're not gonna do high ticket. So I don't waste my time, guys. Just go to the bottom, read the bottom of the job. It'll give away who they are and you can move on. You waste too much time reading the job that you just fall in love with the job and then don't even realize the qualifications don't include you. This was fairly open. Anyone in Massachusetts? It says remote. Sometimes you have to live in the state. Sometimes you have. This one doesn't say if you have to live there. If it's open-ended and doesn't say you have to live there and it says remote, then it's fair game. This might be open, guys. This might be open to all of you. I will put this in the chat. Notice it came up from the term collaborative. I'm not searching entry level. I'm not searching public health. I'm not searching. And then maybe some of you may have overlooked it because it's consultant. You're like, oh, I'm not a consultant. But the associate is more of that entry level, hence why they're giving you, what is it? sorry, 1 to 2 years. This is what's going to get you guys. Whoever gets a callback addresses this one. Do you see that? Whoever addresses this buried bullet that says highly desirable will get the callback. Questions on this? I don't want to move past this point, because this goes back to like, how do we know the kind of experience they're looking for? It's like you have to read carefully through the qualifications. This would be part of your first line, if not your second line in your summary. How do you meet your experience with public health accreditation and quality initiatives, or quality initiatives? Maybe you have the quality initiatives down. Quality control, data management. Accreditation is in the key terms guide. It is one of the 70 terms to pay attention to. Okay, accreditation is the space where you help an organization sustain basically their paperwork so that they continue to receive funding. So it's basically it is a lot of administration, but you're coordinating across the organization so that they submit required accreditation documentation showing that we have financial sustainability down, we have our structure of our organization down. So they have to do these certain submissions for the accredited body. This is rampant across public health, rampant across healthcare. And so if you're in this space where you're like great at project management, great at quality control, data management, want to find, where do I find jobs that help me with higher level, right, complexity for public health administration, this is it. This is it. So I'll save this, put it in the chat, unless I already did. Maybe I already did. Questions? No. Okay. Just don't want to leave that point out. All of it is buried at the bottom. It's all buried at the bottom. Ooh, who's in Georgia? Who's in Georgia? We got a lot of Atlanta folks. Nursing, boo. Sorry, nurses. Not to be, you know what? I'll save it. I didn't say boo. I just meant very few of our followers have a nursing background. I have had a few mentees who are nurses. We love our nurses, but I know that most of us are here because we don't have a medical background. So the boo was a joke. 211 community health resource specialist. Nope. No. Also, sir. Okay. Just please note that sometimes healthcare companies call their patients members. So I know I just talked earlier about like membership-based groups that serve the workforce. And now you're going to run into the word member, but they're referring to their patients and the individual they serve. So know what you're reading, careful. Don't go crazy looking for like, where does it say Solace Health is a membership group? And that's not what I meant. Hi, Maya. I do have a medical background, but it's not in nursing. And so many of the jobs. What's your background in, Maya? Can you remind me? What is it?
I'm an ultrasound tech.
Okay. And you don't, because they cite nursing specifically.
They
Yeah.
do. They all say RN.
Yeah, I think but there are jobs that will cite clinical experience, managed care experience, right? So you still have that if they cite it that way. So yeah, you're gonna have to weed out the ones that say nursing. Yeah.
Yeah, I do see those, but they're not as common as the nursing ones, unfortunately.
Yeah. Yeah. That's a great example. You were ultrasound tech, coming from that space. Love it. Okay, questions? Anyone have, we have 15 minutes left. Anyone have uh any recommendations or wishes of something to search? Focus area, how do you get to that space? I know someone asked about epi, but I know not everyone's looking for epi either. Search best practices. Just mix it up, see what some best practices come up. In public health, we scale best practices, we adopt best practices, we ensure best practices, we stay up to date to best practices. It all depends on what best practice, like there's a variety of them, but essentially it's, making sure that there's standards that are maintained and that we're staying to gold standards, proven methods, best practices, that kind of space. Even if you come from like a clinical background or, even the ultrasound space that you mentioned, Maya, there are best practices you implemented. So don't take that kind of work for granted. That's just how you would frame it if you apply to these jobs. Kim, hi. Any thoughts on being competitive with 2-year gap on resume, trying to get back into the workforce? Hey, yes, great question, Kim. So when people tell me there's a gap, I start to kind of clarify if the gap is purely gap of unpaid or if you've done anything in the interim, even if it was at church or with family or anything. So that's my first question to you is, in those 2 years, was there anyone you helped, any caregiving, anything, just to kind of clarify if you were active at your church? Because I'm just wanting to clarify if it's a true 2-year gap, like some of you are going to school for 2 years and you don't work. Like, I just want to clarify if that's what you're referring to, Kim, or there was like a 2-year unemployment completely.
Um, there were some little things, but mostly just a gap.
What's the little things? Tell me more about the little things.
Um, like a leadership position in my like a running team, some volunteer experience, mm,
So then you
then
don't,
just like caregiving as well.
so you don't have a 2-year gap. All those little things matter.
Okay, so put them on the resume.
Yes. Yes. You want to shape them as a role. So you said you volunteered. What did you volunteer? What'd you do?
Um, like soup kitchen, food, access stuff.
Oh my God. Yes. Yes, Kim. Yes. Even if it was for like a weekend, it doesn't matter.
Okay.
Are you worried about the length of time?
Yes.
What was it? Like,
Um,
how long did you do it just to help with your sense
oh,
making?
oh, just like sporadically, maybe like once a month,
For how long?
for like the 2 years.
Perfect. That's 2 years. That would go on your resume. It would show January 2023 to January 2025 kitchen volunteer or program volunteer, or just, you could just put volunteer if you want. Then underneath would be the company name. Then you would list, you know, monthly. If you want to disclose that it was monthly, you can. You would just do that in the bullets.
Okay.
Yeah. You don't have a 2-year gap. Yay.
Okay, so you think it's better to like list out these smaller things rather than just leave it blank for 2 years, even if
Correct.
it's not
Yes.
like directly in my career path.
Correct. Yes, because
Okay.
there is a momentum that they want to see you building. And if anything, the employers always want to see that you're active in community or just active, period. It's not about being paid or unpaid. It's that you're actively involved. And
Uh,
that is you being involved. Yeah.
okay.
Yeah. And you would put that under leadership if you want. So there's a section that you could put in your resume that it's the 4 sections on your resume that really matter and help people get jobs is summary, education, experience, and your 4th optional category is leadership. So if you don't want to list it under experience due to whatever reason, you can definitely use it under leadership, and that'll be a nice little like cherry on top that they'll see like, oh, this is what she's been doing for the last 2 years, you know? So it's kind of up to
Okay.
you where to put it. Yeah. Cynthia, but we don't want to exceed 2 pages. Correct. So just to clarify, your master resume can be as long as you want it to be. Your master resume is something for yourself. It's something that you may want to share via email with, I don't know, with someone that you're networking with, right? Your master resume can be as long as you want it to be. But when it comes to actually submitting for a specific job, like the ones we're searching for here on the screen, that's when you have to be mindful of cutting it to 2 pages and maxing. You can do 4 to 7 roles, 4 to 7 roles. That can be under experience or under leadership. It doesn't matter. Up to 4 to 7 roles. There's a sweet spot. I don't know. Some people try to squeeze in 8 roles, 9 roles, and you lose the richness of the other roles. So for some reason, it's just that sweet spot of 4 to 7 roles that help you get callbacks. Great question, Cynthia. Yeah, your master resume is like a menu where you can choose or like organize later. So just, you know, the tailor does have to cut off at 2 pages. There's some grants work, Disability Rights Fund. This one came up with the search term data management. I mean, some of you might be interested. Oh, 64 an hour. Wow. Wow. That means like I'm pretty sure that's like no benefits then. I'll save it. Maybe some of you want to look into who, sometimes it's not the right role, but the company is worth looking into, right? So sometimes it's doing your own due diligence and educating yourself on who are these companies out here offering these jobs, because they could release a job in the future that really makes sense for you. CVS Health. Hi, Janet. I see you have your hand raised. Go ahead.
Hi, Zoila. Yeah, I just wanted to confirm or expand a bit on that point. When you see some jobs that are something an hour, and it's not like a field worker or a casual thing, it's otherwise just to suggest that they're just looking for a short-term thing or a consultant, or that it's not going to have other benefits. Just to get that shorthand, just to understand that maybe for new students.
Yeah. Great question. Sometimes when I just see jobs that are cited at a higher pay, notice that was 62, 65 an hour, that's putting you into the 6 figures basically. And I know that grants associate wouldn't be the title that aligns with that pay. And so then my instinct tells me maybe it's a 1099 contractor role. And that's what I was looking for in the weeds of the job, where it would say 1099 contractor, not full-time employee. But I don't think it said that.
Okay.
So the
Which is
only on you to clarify that upon you getting a call back about like, how is this pay structure, just so that I understand. Is it like flat 64 an hour, no benefits, 1099 contractor? Or is it 64 with benefits? Because that's great. Like, yes, you know. I mean,
Yeah.
both are great. Both are great. Both are
Yeah.
great. But some of you, I'm glad, I appreciate this pause, because some of you are coming from a space where you were contracted. Like, I've talked to some of you that are getting like, oh, I get 50 an hour, 55 an hour. I'm like, oh, great, that's amazing, but no benefits.
Yeah.
Now you're competing for jobs with benefits and you feel like you're getting lowballed, when in reality, you're actually going into a better space, because now you're not having to pay out of pocket, and you're getting pension, and you're getting retirement, right? Like, there's a whole other like
Compensation. Yeah.
compensation that you really were missing out on for so long, and you didn't understand the value of that. So
Yeah.
mindful of like, if you're coming off of 1099 jobs, which I've done before, I think the most I've gotten paid for is, was it 50, maybe 45 an hour, where it was just hard cash, and it was a cessation specialist. And because I had quit at the Lung Association doing cessation trainings, they're like, perfect. And I was like, perfect, because I need a job. Like, I'm gonna, so I took it, you know, I knew
Yeah.
what it was. But be mindful of, if that's what you're coming from and you're kind of disheartened about the transition, you know, you have to kind of think through the benefits in its entirety.
Yeah. No, it's just helpful also to hear that term about 1099. Like, I'm not familiar with that.
Oh,
Um,
okay, yeah, that's what they call it, a 1099 contractor.
okay. And then also with a lot of the job pay ranges, so I'm sure people are looking at this all the time and sort of wondering, some of the jobs have really huge pay ranges. Like the one you even posted is from 55 to 99. Now, sure, and even bigger, and sure, that's, you know, commensurate with experience, but I mean, you know, it's more than that, surely. You know, is that, I suppose, to do with depending on where you live? Like if it's a remote job, they're trying to lowball you if you live in Florida, but they have to pay you more if you live in New York or something like this. And the wider the, I feel like, also maybe this is wrong, but like the wider the range, like they're less strict about what they're looking for in terms of experience. Like the very tight ranges seem to me like they know exactly what they want. I don't know if you have any comment.
I love that. Yeah, like this online learning manager, by the way, I did post this at the earlier session. I'm reposting it on this chat because it's worth all of you to review. This is a membership-based organization that does basically have a fee for their members to be part of this organization, but it helps with, you know, sustainability of a job. Going back to your question about the range, there's so many reasons for that. Some of it could be tied, like, it's not the hiring manager's decision to have that range, but it was HR's like decision, regardless of what the hiring
Right.
manager wants. It's like, no, this is how we do it. Another reason could be that they already know the grant. Sometimes it's grant money, so they know that small bandwidth that they're working with. Other times they do this wide range, so that way when they quote you in the middle,
Yeah.
you know, that tends to happen. Just be
Yeah.
mindful, guys, that when you see the range, the mid is what you should expect. So if the,
Okay.
you know, it's kind of like how they choose to start the negotiation. And if they want to do a wide range, I don't know exactly what it is, but from my experience, they usually will try to pin you into the middle. Which is why I encourage you guys to kind of, you know, definitely negotiate when you have that range. Good news is I am seeing more salary disclosures, you know, not everyone, but I feel like over time it's getting better. That's the good news. Okay, I have a couple questions and I see that we're on at time, so let me wrap up these questions. But we don't want to exceed 2 pages of experience leadership. No, Cynthia, yeah, I already. How long should I wait to follow up on interview appointment time? Date preference deadline was yesterday. Wait, Megan, I'm confused.
Yeah, so it was the whole thing with like they sent me an interview request last week. And they wanted me to they had like sent me dates and times that they had to then go back and like redo. But anyway, so I got the updated ones. I sent them my preferences like last week. And then, but they want the deadline to do so was yesterday. And so, how long? I haven't heard back yet though on like my appointment. So, yeah, I know. And so, like, how long from the deadline that they wanted my preferences should I wait? Should I wait another day or?
Wait, what? Okay, so your preferences, you selected, what was the last date of, what were the dates you selected you wanted?
Yeah, so they put interview dates and times for like next week on Tuesday and Wednesday or something. Um,
And you chose those dates?
well, yeah, they have multiple times on each of those dates. So and they wanted top 3 times that worked for you. So I sent those. I got a confirmation that they received them, but I just haven't gotten a finalized appointment time.
You know what? It's okay. Given that it is President's Weekend they're dealing with to like, I don't know how their company is structured. If someone took a vacation and didn't send you the email you were supposed to get, I would say no later than tomorrow. Tomorrow's Wednesday. Give them a day. It's just Tuesday. Maybe people have been off, right? Give them a minute just to catch up on their emails. But I would say if by tomorrow, midweek, they should have realized you guys have these appointments to set and they're not setting them, then that doesn't, it's like, hey, just letting you know these were sent last week, following up. Thank you so much.
Yeah, that's kind of what I was thinking, but I was like, I mean, I also don't want to wait so long that it's
I know. And you need to prepare. So I get it. Yeah. Yeah. By
All right.
tomorrow. By
Thank
tomorrow.
you.
Megan. Okay. All right. Thanks, everyone. Great work. Thanks for coming. I hope this was worth your time. Keep doing what you're doing. I know you're going to find a job that works for you guys. DM me. I'll keep trying to do more live sessions like I did earlier. Come to office hours next week. Let me know what's going on. And then whoever needs to follow up on your complimentary 30 minutes mentor session, email me, please. And let's make sure you activate that. Okay. Thanks, everyone. Good work. Bye. Bye. Have a good day. Bye.